Good evening. It's still Tuesday, June 30th. It's 5:50 p.m. We're going to look at another report from today. CBG report number 24, Psychiatric Hospitals Edition, part 1 of 2. This is a series of articles that were dug into based off of recent news about what's going on in the psychiatric hospital, since it's something that no one's really been talking about too much in the mainstream media. So there was some digging done, and this is what was found out. And this is an interview with somebody that works at one of the hospitals for this first part. We were told not to wear masks to save PPE, that we'd have no COVID patients, but did. We became carriers and spread the virus. We saw patients begin to deteriorate. What was different was that so many of them were really unstable. There were a lot of deaths in the emergency departments as well as the wards. I walked into my shift multiple times at 6 a.m. and started the day by doing a desk exam. Dying in the hospital in a pandemic is not something that I would wish for anyone. It's really awful to be alone, ventilated, and not have any access to family or friends nearby. So it's been really horrible for a lot of the families. A lot of patients had been out of their usual care for 1 to 2 months, presenting very psychotic or manic. We were seeing more of these people presenting in a decompensated state. They may be suicidal for reasons related to COVID-19, like job loss and multiple deaths in their family. They lost hope. Frontline workers are feeling worried and or responsible about infecting their loved ones. One felt responsible for the death of a loved one. A frontline worker felt tremendous guilt for infecting a spouse that was working from home but died anyways. These are psychiatric consequences, and we're going to see a lot more. I have patients who've lost family members due to COVID-19, their jobs, their homes. I have a patient dealing with domestic violence, patients who are college students who lost housing and returned to families who weren't supportive. I have patients who've been separated from family or partners due to social distancing. The psychology of the pandemic is evolving. Our patients are talking to us about being cooped up at home, not being able to see family, being worried about finances, being worried about getting infected or spreading it to family. Same with us. It was like a tsunami of patients that basically hit the hospitals. Part 2. Delaware excluded psychiatric hospitals from mandatory staff testing, insists it's not necessary. People with disabilities are now at risk, like nursing facilities across the country. Psychiatric facilities have also experienced serious outbreaks with casualties among patients and staff. Residents of psychiatric hospitals and group homes may include many individuals over the age of 60 with underlying health conditions. Residents may share bedrooms, bathrooms, and other common areas. Some may not be able or willing to observe social distancing due to their disabilities. Staff regularly rotate between shifts, locations, and may even have outside jobs due to low wages, creating plenty of opportunities for those staff to arrive for work with vulnerable residents after having been unknowingly exposed. 74 child and psychiatric beds closed without notice, deemed necessary for preserving access and health due to COVID-19, despite opposition. Mental health care is a crisis in Massachusetts, said Chaplin. The COVID-19 pandemic is exposing emergency departments where mental health patients board for days or weeks to higher risks than ever. And there are no other child psychiatric beds from New York to Worcester. Psychiatric hospital closures have been exacerbated by COVID. This is one of the failings of our system because the system is so based on profit. COVID-19 strains mental health hospitals. Patients with pre-existing mental health conditions feel more stressed and anxious. Some patients left stranded with hospitals unable to move them. There was a psychiatric hospital in South Korea where 101 of their 103 patients contracted the virus. Many died. Coronavirus and psychiatric hospitals. Staff are scared. Due to COVID, patients have been denied discharge. Some feel distress seeing staff in PPE. Staff have been hit, kicked, and spat at. So as usual, I'll post the link. You guys can look at the sources. This is something that people are not talking about. And it being a virus that goes into the brain and goes into the nervous system, goes into the brain, and attacks the brain, and causes all these logical problems. These people are already mentally disabled. How are they going to impact them?